Hi, my name is Cece, and my partner is Tracy. She worked on our poster board, and I was in charge of doing the video. Our project is on how to administer oral medication. So this video will be me going through the steps on explaining how to administer oral medications. The oral medications that we're going to be administering in this video are diltiazem, which is antihypertensive. So we're going to have to look out for the blood pressure in our patient, make sure that it's not too low because it brings down blood pressure. Warfarin, which is an anticoagulant, so we're going to have to look at the INR levels, and that's just showing whether or not the patient is at risk for blood clots. And then cephalexin, which is a antibiotic. So the first step of administering medications to a patient is checking the electronic medical record to the physician's order. Like I said previously, we're doing diltiazem, warfarin, and cephalexin. So on my patient's electronic medical record, it says that at 12 o'clock, she has a prescription for 5 milligrams of warfarin by mouth, 250 milligrams of cephalexin by mouth, and diltiazem, 180 milligrams by mouth. So I would check that with the physician's order, which is on my computer, and it also says warfarin 5 milligrams by mouth, cephalexin 250 milligrams by mouth, and diltiazem 180 milligrams by mouth. So we're good to move on to the next step, which will be introducing ourselves to the patient and going from there.
Come in.
Hello, my name is Cece. I'm going to be your nurse today. I do have some 12 o'clock medications for you. Can I just check your wristband? And can you confirm your name and date of birth for me?
Yes, it's Abigail Ford, May 25th, 1989.
Perfect. And her wristband matches what she says, and it matches her medical record. So now I'm going to go and get your 12 o'clock medications, and I'll be right back. Okay, so we've already gone through the first step, which was checking the physician's orders and the patient's MAR. And now we've introduced ourselves to the patient, making sure they know who we are, making sure we know that they know who they are, and matching them up to the record. And now we're going through the second safety check, which is going through the Pyxis. So we're going to go to the Pyxis. We're going to input our information, do our thumbprint or whatever we do. We're going to look at the patient's MAR again, which is tells us what they're taking for that 12 o'clock time. So my patient, Abigail Ford, is taking warfarin, 5 milligrams by mouth, cephalexin, 250 milligrams by mouth, and diltiazem, 180 milligrams by mouth. Now we're going to go into the Pyxis. We're going to first type in whatever we're looking for, which is cephalexin. It's going to pop out. We're going to look at it. We're going to pick up one of the pills. It says cephalexin, 250 milligrams. Expiration date, we want to check and make sure that it's within the expiration date so that it's not bad, which ours is. It's 10, 15, 20, 30, which means that it's in the expiration date and it's good to take. So we're going to take one of these and we're going to take one of these if it'll let us, and we're going to put it in our medicine cup. And that's one of the medications. Now we're going to go through diltiazem because that's the next one. Diltiazem, type it in the Pyxis. We're going to pull it. It's going to pop out. We're going to look. We're going to check. Diltiazem, 180 milligrams. Expiration date is 10, 15, 20, 30, which means it's within the expiration date and it's good to pull. So we're going to pull one of these. And put it in the medicine cup. And then the last one that we're going to pull is the warfarin. We're going to type warfarin. We're going to check warfarin, 5 milligrams, within the expiration date of 10, 15, 20, 30. We're good to pull this medication. Okay. So we're pulling that medication and putting it in our medicine cup. And then we're also just want to make note that we've already checked the patient's vital signs and information, making sure that her blood pressure was within normal range, which it was. On the medical paper for that time, it said that she was 136/78, which is above a normal blood pressure, which is okay for her to take the antihypertensive to bring it down. We've checked her INR levels for the warfarin, and that was within the range, showing that she's not at risk for blood clots, so we can give her that one. And then the cephalexin we can give.
Come in.
Hi, Cece again. I brought your pills.
Okay.
So this will be our third medication safety check. It'll be checking the MAR against the medications that we pulled from the Pyxis and making sure that they are accurate and valid. So now I'm checking the MAR over here. I'm using this table. I have her warfarin, which is 5 milligrams. Checking the pill. It is warfarin, 5 milligrams. So I'm going to open it and toss it in the cup. Now we're looking at the cephalexin. It is 250 milligrams. Checking the MAR, it is also 250 milligrams. We're going to open it, and it's within the expiration date, as said before. So we're going to put it in the cup. And the last one that we have for her is a diltiazem, which is 180 milligrams with an expiration date, and it's also 180 milligrams on the MAR. So we can put it in the cup. Now I'm going to hand the medication in the cup and water to my patient so that she can take her medication.
Thank you.
I've watched the patient swallow and take the medication. I'm not seeing any reaction. She's not having any, she's not choking or anything on the pills. It safely went down, and no aspiration or anything like that. And that is how you administer oral medication.